We are joined by Dr. Rachel Levine. She's also a trailblazer and happens to be the first openly transgender federal official to be confirmed by the U.S. Senate. Dr. Levine, we appreciate you making the time to speak with us on this, the first day of Pride Month. More on that in just a moment. But let's start out with COVID in America. As we've been reporting, the country is opening up. Many are feeling relieved about that. But how concerned are you about the virus variants like the one just discovered in Vietnam?
Well, we are making significant progress in our battle against COVID-19. As you were saying, the number of new patients is going down, the number of hospitalizations, and the number of deaths. And with our safe and effective vaccines, we can see the light at the end of the tunnel, but we're not there yet. And we can't let our guard down, and we have to continue to dedicate ourselves to vaccinating hard-to-reach people.
And we heard today that Moderna is seeking full authorization. How soon do you think that full approval could come?
It depends, upon the approval process through the FDA and then consideration by the CDC. But we would expect that this month.
And what about specifically for children under the age of 12, with so many parents eager to get their young children vaccinated?
Well, we don't have a timeline for the childhood vaccines. That depends upon the science and the clinical trials that are ongoing. And so we will await the results of the science and when those clinical trials are complete.
And let's turn to the LGBTQ rights. Your department, HHS, made an announcement this month that it will enforce Title IX and also a section of the Affordable Care Act that prohibits discrimination on the basis of sexual orientation and gender identity in health programs and activities. Walk us through what this change looks like.
Well, this is a very important change because, of course, the size and scope of the Affordable Care Act is very significant in healthcare. So this is an interpretation of the ACA and Section 1557 that when the ACA refers to sex and not discriminating according to sex in all of its different programs, that includes, as you mentioned, sexual orientation and gender identity. And we'll be working throughout HHS to implement those plans.
What's your take on states trying to restrict transgender athletes from playing sports at high school and college levels?
I think that they're very challenging and unfortunate. I think that trans youth are very vulnerable. They have often faced significant bullying and harassment, and they need our support. They need to be nurtured, not to be limited from their activities such as sports.
Before HHS, you were Pennsylvania's Secretary of Health, leading that state's pandemic response. You certainly won a lot of praise in that role, but there were also some ugly incidents like bigoted statements or that Bloomsburg fair where there was a dunk tank appearing to mock you. You reportedly said in 2016 that with few exceptions, being transgender has not been an issue. Do you feel that changed at all as your role became more public?
Well, I am laser focused on my public health mission, and that was true at the Pennsylvania Department of Health and now true as the Assistant Secretary for Health at HHS. And that includes, of course, COVID-19, the increasing number of overdose deaths that we're seeing, health equity, and many other programs that we need to work on and achieve in public health. That's what I'm focused on. But this is Pride Month, as you said, and I think that it is very important to advocate for equality and health equity for the LGBTQ community.
And lastly, kind of piggybacking off of that, what do you feel are potentially the most harmful misconceptions about transgender people, particularly in your field of public health?
Well, transgender individuals such as myself are really just like everybody else. And so that is why I'm so grateful to President Biden that he nominated me to this position, and so grateful to the Senate for approving me with a bipartisan vote. And now I'm going to dedicate myself to my public health mission. And that is the same as transgender individuals across the country doing good work throughout our nation.
Dr. Rachel Levine, Assistant Secretary for Health at the HHS, we thank you so much for your time. Appreciate you joining us tonight.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.